Guys, I got water because I don't really feel good at all. Like, I feel really dizzy and I feel like I'm gonna like pass.
Oh my gosh! I heard she has diabetes.
Which type? Type 1 or type 2?
What's the difference?
In type 1 diabetes, the beta cells in the pancreas which create insulin is destroyed. The body can no longer make insulin. Without insulin, cells can no longer receive a signal to allow glucose through the cell membrane. In type 2 diabetes, the body's beta cells are still alive, making insulin, just not enough to sustain the body. In type 2, the insulin receptors can also build up a resistance to insulin, causing it to be harder to bond with the receptor and allow glucose to enter.
How does she get diabetes?
Well, it depends on the type. In type 1, she could have had a virus, or it was hereditary. Type 2, however, again, it could be from a lack of physical care inside and out of the body, as well as a virus that may have caused her beta cells to malfunction, or her insulin receptors to build up a resistance to the insulin.
How do you figure out if you have diabetes?
Well, your doctor can perform a test called a GTT, or glucose tolerance test. It tests the amounts of glucose in a person's bloodstream, particularly the plasma, over a set period of time. Ideally, the glucose in the blood will react positively to the insulin, and the amount of glucose in the plasma will decrease because it has entered the cells via glucose transport, signaled by the insulin, connected to the insulin receptor. But in diabetes, this doesn't happen as it should. The glucose levels spike when food is consumed and stays high because the insulin isn't working properly to allow the glucose entrance into the cell.
Oh, but what about Miranda? She didn't tell us she was feeling dizzy or something. She should have told us she wasn't feeling great.
Well, remember how she always sleeps during class and went to the bathroom like a lot? Sleepiness and increased urination is a common side effect of diabetes. It's because the glucose stays in the bloodstream and doesn't go into the cells to be turned into energy.
Remember, she also used to bark at me in class or cry for no reason. I've noticed that she's been going through a lot of water bottles, like 7 throughout the day. Those are symptoms as well, but why didn't she tell us she could randomly pass out like this?
Sometimes diabetics don't know when their insulin levels are getting too low or high, and when this happens, their body just shuts down.
But she exercises regularly at practice. Isn't diabetes for people who are out of shape? I mean, she's plenty healthy.
Well, exercise and healthy eating is great in all cases, but sometimes type 1 diabetes and in some type 2 diabetics, you just develop the disorder. However, type 2 diabetes can be cured with a healthy diet and exercise, as well as insulin that they pump into their bodies.
What about type 1? Is there a cure yet?
Not yet, but they do have insulin injections that they can use for the insulin that their body doesn't produce.
Well, then let's put some insulin in her. Have you called 911 yet?
No.
I'll go call them. EMT here. I just took her blood sugar, 204, way too high. I need to pump her with some insulin. Have you been informed about the professionals that aid in diabetic treatment?
No.
Many professionals aid in the treatment of diabetes and the symptoms that go with it. Podiatrists, for example, work on the lower half of the body. Diabetes neuropathy is when diabetes damages the nerves in the body, and peripheral neuropathy deals with the nerve damage in the feet and hands. Podiatrists aid diabetics with peripheral neuropathy in their feet to help them regain ease of movement because this form of nerve damage can lead to lack of mobility.
Does Miranda have that?
I don't think so, but I could give you the number of a certified diabetes educator if you want to learn more. It is their job to educate those with diabetes. I bet they wouldn't mind educating some interested teens. And because teens are so hormonal at this age, I can refer you to an endocrinologist. Diabetes can affect hormones in the body, causing mood swings, and Miranda had been experiencing them lately. Endocrinologists know everything about the endocrine system and the hormones that are affected with diabetes.
That's cool, but I think Miranda should go to the hospital now.
I hope Miranda's okay.
Her mom just texted me. She says she's coming over right now. She says Miranda has Charcot's joint neuropathic atrophy. Occurs when a joint breaks down because of a problem with the nerves. This type of neuropathy is most common in the foot, she says. Remember the time she fell down and twisted her ankle in practice?
Yeah.
That probably exacerbated her Charcot's joint, and that's why she fell.
Hey guys.
Miranda!
I feel better. My blood sugar got too high, but they gave me some insulin, so I feel better a little bit more. But I feel better. So
So just remember, if it ever happens again, just call an EMT and they'll check my blood sugar and they'll give me insulin.